A new Legislative Finance Committee report is taking a closer look at how our state's Comprehensive Addiction and Recovery Act is working.
It says hospital staff must give the parents of a drug-exposed baby a plan of care and send them home. Target 7's John Cardinelli joins us now with the report's findings. John.
Yeah, Shelley and Doug, advocates and lawmakers saying that the report shows the plan is simply not working and more needs to be done to protect New Mexico's newborn children. The findings from this LFC report evaluating our state's CARA program is leaving child welfare advocates furious.
And this report clearly says this law isn't working, this is a crisis, and that 85% of families who have given birth to a substance-exposed newborn are not getting the follow-up support, care, and services that we promised them, offered them, and told them that they could have.
Some lawmakers also frustrated with the findings.
What stands out the most and should be alarming is that 42% of those who were sent home from the hospital with a drug-addicted baby and given a CARA plan were unaware that they were even under a CARA plan.
But Republican New Mexico State Senator Crystal Diamond says her frustration comes as no surprise.
That we cannot allow this to be voluntary, that this must be a required mandated plan.
Parents of a drug-exposed newborn in New Mexico have an option to adopt a plan of care, something the legislature tried to change last session with a proposal that would have mandated parents take a plan of care if they qualify.
It's really of no surprise that these people with drugs, we don't know whatever kind of criminal activity is taking place in the home, it's not going to welcome the state agency in if they don't have to.
Child welfare advocates like Marilyn Beck say history seems to be repeating itself.
If we don't take this report seriously and make changes, we will lose a generation of children.
In 2021, New Mexico's Department of Health also did a report on CARA offering recommendations.
Not one single one of those recommendations has actually come to fruition.
And if you look at both reports, there's a commonality according to Senator Diamond.
We're receiving the same recommendations sent to CYFD that they've been told year and year before. They refuse to implement those.
While the report highlights how CARA is working, there's still a lot of unknowns about the program.
We requested case files to review these cases, but we were not provided them by CYFD. We were hoping to dig into these CARA cases further and see how they were doing and how they moved through the whole CARA process by reviewing a random case sample of case files, but CYFD did not provide these for us.
The fact that LFC could not get information to complete the report leaves Beck asking questions.
We don't know what we don't know. We don't actually know how many newborns are being substance exposed in New Mexico. This report assumes that we're underreporting by at least 40%.
And CYFD responded to the report saying, quote, "We're disappointed in the overall tenor and tone of the LFC evaluations team's evaluation of the CARA law." Reporting live for Target 7, I'm John Cardinelli.
In the last legislative session, there was a bill introduced to provide universal prenatal substance exposure screening. It was one of the recommendations from the 2021 report by the DOH, but that bill did not make it out of its first committee.